And many kids play sports, and we're all used to a few bumps and bruises on the field, especially as boy moms. Let me just say that. But when should parents take their kids to a doctor? So joining us today is Dr. Candice Kennedy. Thank you so much for joining us to share this important information and message for our viewers.
Thank you.
Of course. So to start off, what sports are most likely to lead to injuries? What do you see the most?
To be honest, any competitive sport could lead to potential injuries because in sports we're jumping, moving side to side, running, changing positions rather abruptly, so we're going to see injuries. The most common would be ankle sprains. That's what we really commonly see at Total Foot Care. We also see nail, injuries where there's blood underneath the nail that can be very painful. Also contusions, which is like a bruise to the bone or soft tissue, and these can actually be more painful and take longer to heal than like a traditional fracture. And last would be probably heel pain, plantar fasciitis or Achilles tendonitis.
To say each one you just said, the bomb just kept going up harder in my mind. Oh my gosh, that sounds so painful. So say your child gets injured in any one of, any of the sports, because you said there's not really any limits there. What should you do? What's the first thing?
So you want to make sure that you sit down with your child and your child's coach to say, listen, if you notice that you've injured yourself during an athletic event, say something. If your coach is busy, talk to your team members. The biggest thing to look out for is intense, sudden pain, a limp that's developed from the injury. If they notice that they can't move the injured area, anything like that, they need to definitely say something so that they can be pulled from the sporting event, evaluated, and determine if they need to maybe sit that one out or if it's safe for them to go back.
So it really sounds like the key is just don't wait. And you had mentioned that ankle sprains are one of the most common student sports injuries. So as a podiatrist, how do you recommend handling foot and ankle injuries? This is something I want to know because as a boy mom, I suspect this is going to happen.
Absolutely. So usually when you're just working your patient up, you want to ask them, do you recall how your ankle rolled? And more commonly, they're going to tell you that the ankle rolled inward towards the midline of the body. The reason this is more common is because the ankle moves more in that direction. And so you want to also look for any swelling or bruising, also establish their pain level. You may want to also get some images such as x-rays or an MRI. You want to immediately incorporate the RICE protocol, rest, ice, compression, elevation. And then as they progress and get better, you may want to start physical therapy, a walking boot, things of that nature to try to get them back out on the field quickly and safely.
Things that don't really sound fun, but absolutely important. So how can we keep our kids safe on and off the field? Your advice for parents?
Definitely. Just, make sure you as a parent that you have a relationship with that coach to make sure, listen, if I'm not there that day and my child is injured, please let us know, pull them out, evaluate them. Also to make sure as a parent that you are saving money to get your child the proper gear, the proper shoes, the proper equipment. That's also going to help to reduce injury. And then have an honest conversation with your child. If they've been prone to ankle injuries in the past or other injuries, maybe try to go with a sport that has a less chance of that injury happening.
Is there a sport you'd recommend maybe?
Honestly, all of them are going to be safe. I think it's just about your child, what their interests are, and then to have a fine line with not instilling anxiety with them going out and playing that sport, but making sure that they're being careful and that they also have a podiatrist, that they can see on a regular basis should an injury happen and or to prevent an injury.
Such good information as always. Doctor, thank you so much. We really appreciate your time.
Thank you.